Hi there, I'm Laura here, the founder of Get Organized HQ, and this video is a whole lot different than the types of videos that I usually do on my channel. So if you are into all sorts of organizing and productivity inspiration, you're in the right place. Go ahead and subscribe. But this video, like I said, a whole lot different. It is more of a personal update and a little bit of encouragement for everyone when it comes to health. So a while back I did a video that was very hard for me to do, and I think this one is also going to be hard to do, where I just kind of opened up about my health struggles. So this was a few months ago. I'm going to link to it below if you're interested in that. And I talked about how basically I've been having chronic health issues for probably about the last 7 years, and they become worse and worse over time. I've tried so many things, from regular doctors to all the tests, to functional medicine, to health coaches, to natural things, to diets, to supplements, to drugs, like all the things, and nothing really seemed to help. There didn't seem to be much of an explanation. And that's kind of where I was at, and I was learning to cope with it. And, it became life altering. Like I couldn't do things that I normally did. I never knew whether it was going to be a good day or a bad day. It was rough. All right, so that's kind of where I left you, and with that one. And so again, if you want to go into more details, you can watch that one. All right, fast forward to now. I'm in a very different situation. I still have my chronic illness. I don't think it's ever. I think it's going to be a lifetime thing, and maybe not. But at this point, it's looking that way. But I have greatly improved it and had an emergency surgery in the ER, which I'm going to tell you about. But really what I want to say here, I just kind of want to give you an update if you're a follower and you're curious, or there might be some of you in a similar situation, so you might be able to take away, something that you could at least check for or look for if you're in a similar situation. But the main thing that I want you to get out of this, and I wish I had heard somebody say this before, is as you hear me tell my story, there's going to be several points, because you know the end. You know that it ended in emergency surgery, which thankfully all is well. I'm so grateful, and I'll go more into that. You're going to think, how did she not know this? This is what I think. How on the face of this earth did I not know that something was wrong that needed more serious medical attention? And I'll explain how, but I also want you to realize what I have realized so much now is that while I thought I was being my own health advocate, I thought I was being standing up for myself and telling the doctors something is really wrong. I wasn't doing it enough. And I'll show you specifically how that was. And here's the deal. I think doctors are great, and I've actually had only basically positive experiences when it comes to different doctors and functional medicine and all the people that have helped me on my health journey. They've all been, I think, genuinely wanted to help, doing their best with the resources that they had. I didn't think anyone was rude or overly dismissive or anything like that. Now, I know that's not everyone's experience, so I'm very grateful for that. But even then, I didn't realize that I was the expert on my own body. I live in my own body. I'm the one who actually knows when something is wrong, and I didn't trust myself enough. And I will tell you, even the morning that I went to the ER, I was even doubting myself. Should I really go? Are they going to laugh this off? And clearly I needed to, it ended in surgery, but I was doubting myself. And I want to tell you this so that you can be your own advocate, and so that my outcomes could have been far worse, including death. And so I want you all to take charge of your own health before it gets that far. So that's kind of one of the reasons I really wanted to share this. And just so y'all can know, kind of how I'm doing and where I'm at, because I know so many of you, I cannot even thank you enough. If you watched that last video and made a comment, I just got so many encouraging comments. And I really love knowing that, a lot of you out there are facing all different types of chronic health things, ranging from just everything. And you're not alone. I'm right there with you. But not only me, you can see from the comments, there's so many of us in this boat, and it's difficult and it's hard and it's life altering. And even when it comes to the main topic of this channel, which is home organization and life management productivity, it affects that a lot. You can't do the same things when you're feeling like trash, 50 to 100% of the time that you could if you were feeling great. And I don't want you to put that pressure on yourself. And I want to help you, give you tools that actually work, that are the most efficient, and I don't want you to put pressure on yourself if you're in that boat. Okay, so let's dive in with what happened. So for several years, I haven't felt great. Basically, when my son was born, he's 7, After giving birth to him, and I had a decent birth, nothing traumatic or anything like that, for which I'm very grateful, natural delivery. And I still felt 7 months pregnant for the next year, like really and truly. I felt a lot of pressure in my abdomen. I just felt off, and I thought, well, I've had 2 babies in 2 years, and like maybe that's what it is. I moved, I was running a quickly growing business, so I thought maybe, but long story short, I started having gallbladder attacks in the middle of the night, and they did a scan, and I had a huge gallstone. And so they took out the gallbladder, and that was magical. That was a very easy surgery. It was laparoscopic outpatient. I felt a little sore, like kind of hard to move because you use your abs for everything. For like 2 or 3 days, way easier than giving birth, at least for me. Now, that's not everyone's experience, but that was my experience. I bounced right back, went great. I felt amazing. It took away all that pain. I did well for 1 to 2 years after that. Amazing. And then some pain started coming back, not in the exact same way, but a lot of abdominal pain. These were my main symptoms, a lot of pain. And so, over time, it started getting worse. So over the next 5 years, the pain would gradually get a little worse, and year after year would get a little worse. And I would have periods of even 4 or 5 months that were pretty good, and then 2 or 3 months that were pretty bad, and then a couple months that were good, and like so on and so forth. So it keeps getting worse. Okay. So meanwhile, I'm going to all these regular doctors, functional medicine, all these things, trying all these diets, and nothing is making any difference. Like nobody's even really come up with a theory. I mean, the official diagnosis is probably IBS, which is irritable bowel syndrome, which means we don't know why. Like there is no pathology for that disease. Like nobody understands exactly why. It just means you're having these abdominal symptoms and digestive symptoms, and there's not a cause that we can point out. And so, I did all the tests, endoscopy, colonoscopy, blood tests, stool samples, like just everything. And everything came back pretty normal. And once we get into the functional medicine, they want things to be in the ideal ranges. And a few things were out of ideal range, but again, nothing, and not even really things that point to like my actual symptoms, which were abdominal pain. A couple things pointed to, well, you should be tired, but I wasn't, So I'm like, I don't know. Nothing really there. And starting about last January, February, maybe, I took a turn for the worse. So it was a full year. And my pain just started increasing. It started being more frequent and longer lasting. I hired a health coach at that time, and I think she's great. Nothing. I don't think she did anything wrong. But we were working on a lot of things. So she does all these tests. She recommends all these supplements. So I start taking all these supplements, always very gradually, make sure I don't have reactions, all that stuff. And I also start working on lifestyle change and diet change, which I had worked on many times before, doing things like all the things you would expect: gluten-free, dairy-free, gluten and dairy-free, low FODMAP, which is like the gold standard for IBS, low sulfite, a few other things and I did all these like very, very strictly, like an engineer, because I was an engineer, would do them, like weighing things, making sure I'm, following these to a T, and I see no improvement, or sometimes it gets worse. And so we were just trying to gradually make healthy changes to where I was eating a lot more protein, gradually increasing the fiber, and just eating, healthfully. And so as we did that, what would happen is I would start to, take my protein, which was averaging, this is embarrassing to say, but I'm just going to tell you, around 50 grams a day. And we wanted to get like 130 is my goal. And so we're like, okay, let's increase it by like 20. So I'd go up from 50 to 70, and I would do that for 3 or 4 days. And then I would just be in dire agony, like kind of pain, like real bad. And I specifically remember exactly when it hit this summer, where I was like, oh my goodness, this is a new level of pain. Like I've been feeling a lot of pain, all along, but this is like a new level, and almost times when I just literally could not function. And it would be so bad. And this is the first time that had happened, that I couldn't even work, or didn't even want to watch TV. Like normally I could always work. Like I could get out my laptop, I'd be in bed with the heating pad on, comfortable as I could get myself, and I could get engrossed in work and kind of distract myself, and I could get a lot done. And I view that as like a huge gift, that I didn't have to sit around and do nothing and feel sorry for myself. Like I was still able to be productive and work. And then sometimes when I really wanted to, I would let myself like watch a Hallmark movie or something, because I enjoy those, or whatever, But there were times I was in so much pain, I couldn't even watch TV. Like I was in that much pain. It wasn't quite as bad as like the latest stages of labor, which is what I have to compare it to, natural labor. But that's the worst pain I personally ever felt in my life. It wasn't quite that bad, which I think is something else that kept me from like going straight to the ER, because I'm like, well, I have felt worse pain in my life, but this is pretty bad. And it would never last like continuously for more than probably 4 hours maybe. And then it would start to let up some. And even usually within those 4 hours, it might be a couple hours of really bad, but then it would start to kind of let up a little bit for a few minutes and come back. And, that's kind of how it was. All right. But meanwhile, since we were increasing and kind of making dietary changes, introducing supplements, what we would think is that, okay, I just made a huge jump in protein from like 50 to 90 grams. It must be that. So then we would backtrack and we'd be like, well, okay, we're going to go back to 50 for a few days and then we're going to try to go up to 60. Okay, so we do that and then we go up to 70. Oh, wait, no. Now I'm in terrible pain. So we backtrack. So I couldn't even make these changes. Like I could not even eat the required amount of protein because we thought that it was causing me all these problems. And so it was really keeping me stuck in less healthy, overall diet and even exercise. She encouraged me not to overdo the exercise because my body's trying to heal. And so, yeah, I would move. I wasn't no exercise, but I stopped, spinning on the bike and doing the more, intense, I would say I wasn't quite doing intense, but, just under intense exercise. We kind of stopped that. And just everything seemed to send me into a tailspin. I kept trying thing after thing. Okay, meanwhile, you might be thinking, well, why didn't you go to the doctor? I did many times. So I'm already seeing the gastro specialist, the gastroenterologist, because, of all these issues. And I have regular appointments with them. They really, besides doing some diagnostics, they really haven't had a lot that helped me. But I remember going there, and I remember about this summertime, I started thinking to myself that I thought it was my hernia. So about 2.5 years ago, when I'm recording this, you're going to watch this a little bit later, but when I'm recording this, it's March, and the surgery that I had was in February. So at that time, it was about 2.5 years that I've been diagnosed with a hernia. All right, now, I'm going to give you medical warnings when I'm going to talk about medical details, because I know some people are just you're kind of squeamish about it, so you might want to jump ahead a little bit, because I'm going to go into a little bit of medical detail here. Okay, so what a hernia is, if you're not familiar, mine was just above my belly button, and that's where your muscle kind of separates. So it's supposed to be together. It separates, and it separating alone is not considered a hernia because you wouldn't even know. But fat starts poking through. So a layer of fat pokes through. That is what a hernia is at the most basic level. And when you're at that level of hernia, there is no problem. Many people don't even know that they have one, and I wasn't even looking for it. They were just doing a general CT scan just to see what was, causing all my issues, and that's when they discovered that I had the hernia. But they're like, perfectly normal. Walk around with these for years. No big deal. Was kind of the way that they presented it, and it was okay. So I'm thinking, and also didn't have any pain at the site of the actual hernia. By the way, it was from the incision of the gallbladder. It was where they made the incision in the laparoscopic gallbladder surgery, and it's very, very common to get hernias there. So that's up to 25%, I think, which I wasn't aware of. And I still would have done the gallbladder surgery had I been aware, because it gave me my life back then. It was a necessary thing to do. And I also want to say this is just my personal opinion. A lot of people, and I'm kind of digressing here, but I've heard a lot of people say, you shouldn't get your gallbladder out because there's, that's bad for your digestion, and it's going to cause all these issues. Okay, here's what I want to tell you about that. If you happen to be in this situation, the problem is not that you remove the gallbladder. The problem is that you got the gallbladder disease in the first place. Because when you have the gallbladder disease, now your gallbladder is not working the way it's supposed to. It's causing you terrible pain, and the problem is that you got the gallbladder disease. Removing it really doesn't help. It helps with the pain, but the problem, people are saying, when you have the disease, you should try to keep your gallbladder or something, which, I don't think gallstones go away. But the problem was that you got the disease. You were already, your digestion is impacted, your everything. So the problem is that I got the gallbladder disease. That's what I needed to prevent, not getting the disease and then getting the treatment for the disease, which is removing it. Ideally, I would have prevented the disease, but of course, that's easier said than done. Do the research yourself. Nobody really knows what causes them and how to do it, and it's very genetic and things like that. So, if you can, I would highly recommend not getting the gallstones and the gallbladder disease in the first place. But obviously, I can't even tell you how to do that. So, that would be the ideal. So I just want to kind of digress there that I'm very happy I got it taken out. But I really wish that they would have said, hey, there's a risk of this, watch out for this. But they didn't. I had no idea until I was diagnosed with it, and then I did the research and figured out, this is very common. Okay, so I get this hernia. Again, no pain there. And here's what I did. So when I got diagnosed with it, they gave me a referral to a surgeon, and they're like, you can go to the surgeon and get this repaired. So I met with a surgeon. Again, this is about 2.5 years ago. I set up an appointment. I meet with a surgeon. I talked to him about it, and he's like, yeah, we think you should get this fixed. Like, there's bad things that can happen. The two bad things that can happen is it can grow and it can just get ridiculously huge. The second bad thing that can happen is it can become strangulated. Okay, so medical stuff coming up here. So strangulated means that it's not just fat poking through the hernia. It is also, in the case of, a stomach one, bowel starts poking through. So like intestine or colon starts poking through the muscle. So it's still in your skin, like, you can't like see it, but it starts poking through. That in and of itself is not strangulated, although it's not, ideal. And then the muscle will start to constrict around it, and will constrict so much that it cuts off blood flow and the tissue dies. When this happens, then you have sepsis in your body, and even with immediate medical treatment after a strangulation, you have like a 10 to 20% chance of dying. So that is bad. I mean, bad. You do not want that. So they did present that risk, and he said it was a very low risk. And so he's like, yeah, you can get it fixed. And so I scheduled the surgery. It was going to be a robotic laparoscopic surgery. They were going to do it with mesh. It was going to be laparoscopic, outpatient. Not too much, probably worse than my gallbladder. They said the two biggest risks are, one, recurrence. Even with the mesh, which is a better repair than stitches, recurrence, like it coming back, is pretty high. Now, again, you can just have another surgery and get it repaired again, I guess. It's not the end of the world, but that is a huge risk. Like it's decently likely to come back at some point. It could be years and years and years down the road. And also, I was relatively young, so it had a lot of years, to come back. And then the second risk is infection of the mesh, which is really bad. You don't want that. That's 1% to 2%. I don't know what the exact risk is, but that's obviously a risk. And infection is a risk with any surgery. I think with the mesh, it's slightly higher of a risk. All right. So now, in retrospect, and hindsight is always 20/20, right? I should have gone ahead with the surgery and gotten it done then, and we wouldn't have been in this boat, and I would have saved myself a ton of pain. But just after scheduling the surgery, and I scheduled it for like a month out, I went to my regular doctor for a regular, just like annual checkup or whatever. And at that appointment, I asked her, I was like, hey, I was diagnosed with this hernia from the CT scan. And, I met with a surgeon. He kind of suggested like it wasn't like super urgent, but I should get it fixed. So I went ahead and scheduled the surgery. But like, what are your thoughts on that? And she was like, you know what? I wouldn't do it if I were you. Like, people walk around for hernias for like years and years and years, and there's no pain at the site, so I don't think it's giving you any problems. So I just don't see much reason why I would, go through that surgery. And I mean, that kind of made sense to me. Like, even though it's a minor surgery with relatively low risk, there's always a risk anytime you go under anesthesia, risk of infection, like all these things. It's inconvenient. You got to take some time out to go to surgery and recover. It's expensive. So yeah, I mean, that made sense to me. And if my regular medical doctor is telling me that she wouldn't, then why would I do it? So I canceled the surgery. Also thinking that maybe the surgeon probably likes to do surgery. So like he probably thinks it's a good idea. So I canceled it. All right. So that's what happened 2.5 years ago. Then again, fast forwarding to last summer when I started getting even more and more pain, I started to think it could have something to do with the hernia. Now, here's the deal. I did not have much pain, if any, at the actual site of the hernia. But I had a lot of pain all around it, and just way worse pain. And I just started to feel like, I just started to think in my mind, I feel like that is probably the hernia. And I was like, is this even a thing? Is this my imagination? And you've got to remember, this is what you've got to keep in mind. I've had lots of pain all for years now, and it's been changing and it's been getting worse. So just pain wasn't a huge red flag like it might have been had I been 100% healthy, not really experienced abdominal pain, and then gone to this pain. I would have been right to the ER. But considering how much I'd had, and everyone's like, oh, we can't find anything wrong, I just thought, well, I mean, this is probably more of the IBS. It's just getting worse, got to figure out something. So I did go to the gastro. I brought it up with them. They're supposed to be experts on abdominal stuff. And she was like, I don't really think it has to do with, your issues. So that's basically what I asked her. And she thought, she didn't say like absolutely not, but she said it didn't really sound like it would, contribute to the particular issues you're having. Meanwhile, I did try more drugs this year, like pharmaceutical drugs. I tried amitriptyline, another one that's very similar to it. Those are like drugs that are supposed to help with like ongoing pain for like IBS. They help with migraines. They can also be used as antidepressants in higher doses than I was on. I tried those earlier this year, both of them. The first one I tried, the amitriptyline, that's the generic name for it. Like it has a different brand name that you might recognize more. Oh my goodness. I was on the lowest dose you can possibly take, 10 milligrams. And the doctor said, hey, 300 is the max dose. So like, you're nowhere near that. And if you were starting it for antidepressant purposes, which is not something I needed to treat, you would start at 50. So like, we are at a very low dose. I was so tired. I slept, I kid you not, 13 plus hours a day for the first couple weeks. It did level off after about 3 to 4 weeks, but I was still sleeping a good solid 10 and a half. 11, whereas normally it's more like 7.5 hours that I need. So wasn't loving that. It didn't seem to do one bit to help me. I tried another one that was less drowsiness. It did nothing. The other one I thought maybe it helped me a little bit. I tried a couple antibiotics. The gastro was like, we can treat you for SIBO. I know you've tested negative twice, but let's just treat you for it. That's small intestinal bacterial overgrowth. There's a specialized antibiotic. It was like $1,000 for this stuff. I tried it once. I thought it might have helped because it coincided with a couple weeks where I did better. I tried it again. No, definitely didn't help. Had no bearing, So I'm like, okay, well, that didn't help. So I was willing to try more things. As we get further on and the pain gets worse, it starts taking over more of my life. Well, I'd really like a natural solution, like, a diet change or lifestyle change or something. I'm willing to try other things because I just need my life back, All right. So that's what that gastro doctor said. Well, then I go to my regular doctor for an appointment. Oh, by the way, I'd also been to the urgent care. Saying, I think in February when it first started getting worse, I went to the urgent care and I said, okay, so I've been having these IBS symptoms and like all this abdominal pain for a while, but it's just gotten a little bit worse and different. And I'm just concerned, like, is there something I should be like looking for or like, I'm just concerned. So that's what I did then. And they did like an x-ray and they're like, well, everything looks fine. So they didn't have much to say about that, but I did go. I went to urgent care and said, hey, the pain is worse. I think something's wrong. And they're just like, take an x-ray and it's fine. All right. So like, okay. So then back about 3 months before the surgery, I went to my regular doctor. This is a different doctor than the one that told me not to get the hernia surgery because she had moved on. This guy, who I like much better overall, he's also moved on, so now I have to find another primary care. Anyway, this primary care doctor, I brought it up to him, and I've gone to him like probably 3 times this year. And I went to him and I was like, okay, so, still having this pain, still having these issues, and I said specifically, I kind of feel like the hernia is maybe, I don't know, I just feel like it's got something to do with it. Do we think that's even a thing? And he's like, yeah, you know what? I think it could have something to do with it. The bowel could be kind of moving in and out. It could kind of constrict it a little bit. So I could see how it can contribute. So I would probably recommend getting it fixed. But he's like, it's not urgent at all. I wouldn't, you don't have to go out right now, but maybe, soonish, So I was like, okay, I'll do it after our team goes on our Disney trip. So it was going to be later in 2024 that I was going to go ahead and schedule the surgery. I thought I should get it fixed, but he wasn't at all thinking that it needed to be urgent. Then I went a step further. This was me thinking that I was doing a great job of advocating for myself. And I was like, okay, all right, I get that. I think that makes sense. I'll probably, schedule it, in about 6 months to get it fixed. He's like, that sounds good. But I said, also, I want to address one other thing. I've been having a lot of pain and a lot worse pain. I just have a lot of pain. And I know there's a slight risk of strangulation. I know it's pretty slight, but how would I actually know if something more serious is going on? Whether it's a hernia or something else, and I actually need more medical attention. How would I know? Because I have so much pain. And he was like, oh, I think you would know. The pain would come. It would be just absolutely terrible, and it would not go away. It would not let up at all. Because a lot of my pain kind of 20 or 30 minutes and it lets up for a few minutes and then it'll come back, and it'll let up. So I was like, okay, so that would be the characteristic. He said, risk of strangulation is extremely low. Your hernia is relatively large, and that actually makes your risk of strangulation lesser. So that risk is pretty low. So he was pretty dismissive, honestly. He thought it was very unlikely. He thought I would absolutely know. There would be no question in my mind if it happened. And I was like, all right, then, if that's what he thinks. So, I really brought it up. Now, in retrospect, I should have said, I still don't feel comfortable with this. I think I need a scan. That's what I should have said, because I knew something wasn't right, and I knew it was that. I'm in my own body, and I just know. I don't feel good about this. But no one had presented me with any other options than you have a regular hernia or you have a strangulated hernia and you might die. This is what I thought hernias were. I thought there was no other option. No one said anything else about any other negative hernia outcome where it could really need repair. All right, so this is my last visit to the doctor. Then fast forward 3 months. It keeps going on. And then on February in mid-February. We had our Valentine's party. We host a big Valentine's party here. It was so much fun. I was pretty off and on rough throughout the day, and I was like, oh my goodness, I'm gonna have to, go through this party with this. Actually, this is weird. I was so grateful I was at my own house because I could participate and still go lay down if I needed to. Like, if it had been at someone else's house, I don't think I would have been able to go. But because I was hosting at my own house, I was able to participate. So I was so grateful for that. And then it was just like a true gift that about the time the party started, I just started letting up, and I got to enjoy the party. Like eat the party food. We played the Newlywed Game. We did that. We had a lot of fun. Everybody goes home. We straighten up a little bit, not a lot. We go to bed. I'm feeling good. I'm like, oh my goodness, yeah, I'm feeling so much better than I was. A couple hours ago. We're doing great. I go to bed. It's like 10:30, normal time. Go to bed. I wake up at 1 a.m., maybe 1:30. So I'd had maybe 2.5 to 3 hours of sleep. Wake up from the pain. And I've had a lot of times where the pain makes it hard to go to sleep. Like I have to be really tired and really ready because it's just bothering me. But I've rarely had the pain so bad that it woke me up. So it wakes me up. It's as bad as it's ever been, maybe a little bit worse. It continues on and almost continuously from 1 to about 7 a.m. Again, it's not the type of thing that comes and doesn't let up at all, which again, I'm thinking the doctor told me it wouldn't let up at all. Well, this is coming for like 30 minutes, and then for 10 or 20 minutes, it'll be like at a pain level, 7.5, and it'll go back down to 2 or 3, And so I'm thinking it's probably not that, but I'm thinking, in that moment, it was just like, I knew something was wrong. This is worse than ever before. Something is wrong. I cannot go on with my life. I've got to go get some medical attention. Well, it was Saturday night. Flu season is in full swing. So I'm like, do I go to the ER or do I go to the urgent care? The urgent care I normally go to is closed on Sunday. Another urgent care only takes appointments, and their next appointment, this is I'm Googling this at 2 a.m. literally, because what else am I going to do? I can't sleep. I'm in too much pain. So the next appointment was 4:30 p.m. the next day because again, flu season was real bad at that time. And I knew, there was going to be a lot of people there. And I was plus I was kind of all they can do is x-ray. That's why they x-ray you. They can't do a CT scan. And I knew what I needed was a scan. So I was kind of and plus if they find, so I thought one or two things would happen. Either I wouldn't feel good, I wouldn't feel very confident that nothing was seriously wrong when I went there because they couldn't do what they really needed to do. So I'd feel kind of still not feel confident. Or two, they'd be like, hey, this is a hernia. We can't mess with this. We got to get a CT scan. You got to go to the ER. So I'm all right, I'm just going to go straight to the ER. So I'll wait all night. In the morning, as soon as the world is up, I make phone calls. I actually got, my husband took my kids to church and my mom went with me to the ER. I'm so grateful to live close to family and have someone to go with me. So grateful for that. And so we go into the ER about, we probably got there 8:30 in the morning. And I take my mom because my husband is a little squeaky with medical things, so she does much better. So I was very grateful. They were all wonderful and nice. And I remember even thinking, after I decided to go, this is so stupid because it started to let up a little bit. And I'm I'm going to walk in there and I'm going to be at pain level 2 or 3, which is no biggie. And they're going to be why are you here? And the whole thing is going to be ridiculous. And they're going to yet again say, we can't find anything and send you home. As if I've been to the ER all the time. I've only been on one other time for this 2 years ago. But, anyway, so I'm thinking this. I'm almost talking myself out of it. But then it just keeps coming back to I know something is wrong and I cannot sleep. Until I know that nothing is wrong, but I'm what if it, okay, so I'm going through all this stuff and I almost don't even want to go. So I get there. Again, very nice. They check me right in and they're I explain my symptoms. They don't even ask that many questions. They take a couple blood tests. They give me some drugs to help with the pain, which did help. By the way, it doesn't take it away, but it really helped. And I was okay, well, that's nice. And then they were we're going to do a CT scan. So all right, great. And I was very grateful because I knew we needed to see what was going on in there. The longest wait we had was probably an hour to an hour and a half to wait for the CT scan. We're just in this little chair thing, kind of this divided room with curtains, waiting for the CT scan. I was feeling okay at that point because I'd had whatever they give you in the ER for pain. So I'm oh my goodness, we just wasted probably all this time and money getting the CT scan where they're probably going to tell me everything's fine. They come back 15 minutes later and the girl is yeah, we found out that your hernia is incarcerated. By the way, I didn't even know what that meant at the time. And so we're going to send surgery down here to talk to you in just a minute. I'm okay. I'm still thinking surgery's going to come down and they're going to be okay, yeah, you need to get seen about, here's a referral, but whatever. They take me to a room so they can examine me. The surgery is down there within 2 minutes. The actual surgeon and somebody from the surgery team is both there. And he's like, yeah, your hernia is incarcerated. We're going to take you into surgery. Is the OR ready? And she's like, yep, I got the OR ready or whatever. And I mean, literally, the anesthesiologist was down within another couple minutes, and he's, you know, like, okay, they assigned the things to, like, yes, I authorize you to do a nerve block and send me to anesthesia, or like put me under anesthesia. I mean, literally, it's so fast. Like, I have no even time to like think, like, okay, well, I guess we're doing this. And I was so unexpected because I was thinking, yet another time they're not going to find something, and you know they're just going to send me home. But no, they found something. So it was probably, from the time I got out of the CT scan until I was in surgery, was probably less than an hour. I texted my husband. I was like, I'm going to surgery now. I think my mom called him. You know, I was wheeled away pretty quickly to go, you know, get the surgery. I think my mom called him, and he was able to send the kids with somebody, you know, to take care of them, and he was able to come to the hospital. So he was there when I got out of surgery. And the surgeon, so here's what was happening. Okay, so medical details alert. I'm going to explain exactly what this means, but these are some, like, you know, medical details. So fast forward a little bit if you don't want that. Okay, so like I said, a hernia is fat pushing through the muscle. Strangulated is when it cuts off circulation, and that's really, really, really bad. Incarcerated, and I was not even aware that this was a thing. Even, I don't even know if Google tells you, maybe it does. But like, I didn't even know this was something to watch out for. Incarcerated means that the bowel is now pushing through and it is stuck. Like the hernia cannot be pushed back in. And also he said there was inflammation around it. So it's building up inflammation and it's just getting stuck there. And it is constricting it to some degree. And so that's not good. It's not good for so many reasons. And by the way, this had 100% been happening for months. This was developing. So it's, you know, getting worse over time. I 100% know the type of pain that it is. It's different. It's gone now that I've had the surgery. It was gone, even recovering from surgery. When I was still in pain from the incision, it was gone. You know, the pain, that kind of pain. I'm still having the other pain, but like that just intense pain is gone. And so like it's been happening for months. And again, none of the appointments caught it. And what the incarceration means is that, yeah, like I said, it's stuck in there. But what could happen that would be really bad, and why it was considered an emergency and they wanted to operate right away, is that the longer it goes, two things could happen. One, it could become strangulated, cut off the blood flow, and that's real bad. Also, even if it doesn't become fully strangulated, the bowel can die, and that's where they would have to resect part of the colon. And he said, you know, I have to warn you. He said, I don't think this is the case from looking at all your, you know, scans and whatnot, but you could wake up with part of your bowel resected and a colostomy bag that you would probably have to wear just for a temporary time. And I was like, oh, okay. Like, so he just wanted to let me know, but he said, I don't think that's the case, but I just want to let you know that is a possibility. So that was the possibility. If I had not trusted myself and actually gone to the ER, if I had talked myself out of it and we're still, you know, and fast forward, like that's what could have happened. Fortunately, surgery was super short. I don't even think it was 45 minutes long. And it went super well. He was able to, like the bowel, he said, looked perfectly healthy. No problems there. He was able to put it back in, stitch it up, and that was that. But the downsides were that he only used stitches and not mesh. I think when you have it incarcerated, the risk of mesh infection is slightly higher, and I could tell this doctor is very conservative. So he said it's probably going to fail. Like the chances of it failing are very, very high. And then I'm going to go need to do the laparoscopic mesh repair anyway. So I'm going to have another surgery at some point. We don't know when. He said it could be years. It could be, who knows, you know. So some point I might need that. Also, this was an open abdominal surgery versus the laparoscopic repair, which means they have to like make a full incision, you know, open abdominal surgery, which is a bigger deal. And you have to stay in the hospital. I stayed in the hospital for 3 days just because that's standard procedure to make sure everything is okay after this type of surgery. So I did have to do that. But, you know, I'm just like, I cannot even tell you how grateful I am that I did go in when I did. Like, had I wished I'd gone in 6 months earlier when I kind of knew what was going on? Yes, I do. Like, it would have saved me 6 months of terrible pain. But I'm like, look at how much worse it could have been. And I really think it was like literally God's providence that made everything come together like that I went when I did. Because I realized this. Had it been not a Sunday, I probably just would have gone to urgent care because I felt like I was being like, I kind of felt like I was being a drama queen, to be honest. Like, oh, you know, I'm in such terrible pain, I gotta go to the ER. Like, it felt dramatic, I guess. Even though the whole experience was calm, and no one at the ER was dramatic, and no one seemed to like, at all, everyone was so kind, and no one tried to be dismissive. Like, they were all wonderful. I can't say one bad thing about any of the nurses or the doctors or anything. But I still felt this way. And had it been any other time, I don't know that I think I would have gone to urgent care, and I could have very easily, after so many of them said, it's not a big deal, it's not strangulated, I just think I could have been dismissed again and been like, you're fine, and gone on longer. And then I would have been like, every time I went to a doctor and they said it was fine, I almost felt like I didn't have the right anymore to like, I don't know if complain about is the right word, but I didn't have the right to go back to the doctor again because they just said it was fine. So I didn't feel like I had the right to go to urgent care or ER or something because they just said it was fine. Now again, this might be me and my own dumb issues, but again, if you have similar issues, I want to just advocate for yourself, because again, it could have been so much worse. And then the fact that it happened in the middle of the night, that just was like a huge red flag to me. And yeah, I really truly think it was a blessing that everything came together the way that it did. You know, the surgeon was wonderful. He did a fantastic job. Recovery, I had to be in the hospital for 3 days. It was fine. Was it, it's not like a Disney vacation, but it's fine. I was in some pain, of course, like from the incision, but I probably only took extra pain meds for like the second day, a couple of them, that was it. And after that, I could manage with just Tylenol, and, so that I felt very grateful for. It's hard to move after abdominal surgery because you use your abs for absolutely everything. So like trying to get out of bed is an ordeal, trying to sit up or sit down. So, that's a little bit annoying, but even by day 2, I walked 6,000 steps easily, because they're like, you need to walk, move around, and it felt decent, to be walking around. I wasn't pushing myself too hard. So I feel like I really recovered so quickly, and I'm so grateful. I mean, it did take a few more days to really move with more ease, but I feel like I recovered well. I haven't had any complications. I'm going for my final follow-up in a couple days, but like I said, everything has gone well. And the other huge blessing is that, again, it definitely did not solve all my problems. I'm now 4.5 weeks out, and I've still had some of my IBS symptoms and things like that, but the worst of the pain, the hernia was responsible for by far the worst of the pain, So that is now gone. And I feel like I have my life back, because the level of pain that I have now is fairly functional. Like, yeah, I'm not knocked out for hours at a time where I just cannot do anything, and I'm not afraid to plan everything. I think my fear of planning is, like, I'm starting to get over that. I think I still will always have to some extent, because like I said, I truly still have the IBS. I still have some pains. I still have some issues. We're not out of the woods. I still have some times where I need to lie down, but it's so much less than it was before, and comparatively, it's just not the terrible pain that it was before. So like I said, I almost feel like I have my life back. We got that, and that was a huge part of the problem. We had to get that fixed. We have to get that variable out of the way before we can now do anything else. So now I'm willing to, especially if it starts to get pretty bad again, I'm going to be willing to try some other diets. Some that I tried before, like the low-fat one. I'm going to do that again, because it's kind of like restarting. We got that variable out of the way. And I just think back to when I was working with a health coach and trying to change my diet 1,000 times. It had nothing to do with that. I mean, I could have eaten anything that anybody says and used every essential oil under the planet and been on every supplement. It wasn't going to do anything, because the problem was physical. Like, that wasn't going to fix any of those things. So it was just, I don't want to say it was a waste or that I'm sorry that I did it, but it kind of was. Like, it wasn't ever going to do anything. And it was like messing with my mind that I would try to make a good change, and then boom, back on, bedridden. Must have gone too fast. Let's try to go up by like 2 grams of protein, and it just wasn't working. And so looking back, I'm just like, man, we did all that, and it was never going to do anything. But again, we got it fixed. Now we can move on with life. But again, I don't know. I know I've said this like 5 million times, but don't be afraid to advocate for yourself. If you think something is wrong, like, you are worth another visit to the ER. Don't worry so much about what everyone's going to think of you, or if they think you're going to be whatever. Like, something is wrong, so go get it checked out. And don't be afraid to be specific. Like I said, I really wish I'd asked my doctor and just said, hey, like, I think we need a CT scan. I wish I had asked more specific questions. Like, okay, so I wish I had said, hey, okay, so I understand that, like, strangulation risk is where, is there anything else with hernias that might happen that might be bad? Maybe I should have gone to, I don't know what I should have done, but I still just know that I should have, I don't even want to say should have. I was doing the best I could at the time, but I could have, and next time I will, I think that's what I'm saying, next time I will be more assertive, ask more questions. I mean, another thing, and I think women do this a lot, I've heard, is we kind of minimize our own pain. So I would walk into the doctor. I'd be looking put together, you know, like I'm dressed in real clothes. Like I don't wear a lot of loungewear. So like I'm in real clothes. I have usually a full face of makeup on, you know, so I'm looking fine. I'm not walking around, even in my worst pain, I wasn't like with a frown on my face all the time. I could, except for the very worst of it, I could probably carry on like if you called me on the phone and only talked for 5 minutes and you didn't know me that well, I could probably sound normal. Like, you know, and most of the time when I went to my the actual doctor visits, I wasn't in my worst pain. I was in a moderate pain at worst, and then I can function 100%. I'll be cheerful. I'll be smiling. I'll be like, yeah, you know, it's really bad. It's kind of messing with my life. What can we do about it? Like, I think that I didn't do a good enough job of being like, no. I have a decently high pain tolerance, I think, based on all of this. And I know I'm optimistic, but it really, really is taking over my life, and something is really wrong. Like, I wish I'd been more forceful about that instead of being just kind of too I don't know if upbeat is the right word, but like, yeah, so it causes them, I don't think any doctor was like trying to brush me off because they didn't believe me, but I think it was more that I didn't present it as life-altering and as painful as it was. So they just didn't understand the scope and the depth of it. So they weren't able to take it as seriously as it needed to be taken. So I just want to encourage you, whatever you have going on, like, be that advocate for yourself. Take care of yourself. Don't be afraid to ask for what you need. And thank you so much for being a part of my journey, for caring about what's like happening in my life. I just cannot believe that I have so many people in my life, you know, who care about me. And I've had so many people, both you all, acquaintances, friends, tell me like they're praying for me, they're thinking of me, and that means so much. And again, if you are in the middle of these journeys, you're not alone. You know, there are so many people out there who are struggling and have health issues, and I understand it is so hard. It takes over your entire life. It affects every facet of your life, and there is no getting away from it. It's hard, and you're not alone.